I figured out how to set this up so it will automatically record so I don't forget.
Yes. You're like me. I have it like set to auto record because I'm like, I am terrified that I'll start something and not hit record.
Yes, I have done
It's
it.
like I'll trim it later.
Hello, folks. Welcome to the, yes, it is November meeting of the Carolina Community Coalition. We are glad you're here. We're going to give folks a minute to get into the room and get settled. And if you will take a minute to introduce yourself in the chat, that way we can know who's here and say hello to everyone. Make sure you change the to everyone. Otherwise, just the three of us are going to see who you are. So I'm so excited about our presenter and our conversation today. I think you're gonna learn a lot, and I know we've got folks from around the state who are excited to hear some of the great things that are happening in Louisiana. So
You good thing going on too, like a basketball thing going on. So Amy, I had to give you that one.
okay. Oh, that's weird. All right, folks, I know there are more people planning to join us today. We are recording today's meeting, so you can save it and watch it later, share it with your friends and other folks on your campus. But we will go ahead and get started so we've got enough time to hear from Allison and have some conversation. We are fancy here at the Carolina Community Coalition. That means you can use the Q&A box at the bottom of the screen to enter questions for our presenter or our panelists today. You can also use the chat function to introduce yourself and ask questions and have conversation with other folks. I am going to read the bio for our speaker. Dr. Allison Smith is the Assistant Commissioner for Student Health and Wellness at the Louisiana Board of Regents. Dr. Smith received a Bachelor of Science degree in psychology from Southern University, 2009. A Master of Public Administration from Louisiana State University, followed by a doctoral degree in Education, Leadership, Research, and Counseling with a specialization in Higher Education Administration in 2016. Dr. Smith has spent the last 10 years working in the field of substance misuse prevention and recovery in higher education, with 8 of those spent at Louisiana State University before moving to the Louisiana Board of Regents, where she currently champions this work. And they have been able to do all kinds of exciting things in Louisiana, but I think we've lost Allison. So we will wait a second and see if she's able to pop back in. Let's see here. This is a first, y'all. I guess this is where I learned how to improv a little bit, right? So make sure you have introduced yourself in the chat so we know where everybody's from. And so we've got a little attendance record here. And we will hope that Allison comes back on in just a second. One of the things she's going to share with us today is about the statewide policy work that they've been able to do in Louisiana. They have 4 systems of higher education in the state. And so it's really exciting to hear, you know, we have not really even one. So we do our best in South Carolina to function across the institutions of higher education, but they've got 4 systems that they were able to work together to implement a policy for all institutions in the state. So we will see. Well, Rachel, can I put you on the spot and ask you to introduce yourself while we're waiting for Allison? I'm trying to kill some time.
Oh, you're so out of practice with this Zoom pandemic style. Hi, I'm Rachel McNamara. I'm from the College of Charleston, and I'm the Director of Student Wellness and Wellbeing. I can give more of a list. I have a master's in clinical and developmental psychology, and I'm also in charge of the peer counseling program at College of Charleston.
Thank you. Appreciate your assistance there. I don't know. Sending the link just in case. She is trying to come back. We're gonna keep having a good time. One of the things I can tell you all about, some of you on the call already know this and have heard this. For those of us in South Carolina, we have a state senator who's gotten really excited about distribution of Narcan and naloxone and overdose education on our campuses. And so many of our college presidents received a letter this week from State Senator Sen encouraging campuses across the state to offer overdose education and naloxone training and distribution to students, as well as faculty, staff, and community on their campuses. And so I've had a lot of conversations this week from campuses that are working on that or have been talking about it. And so it's exciting to see that kind of state level advocacy from one of our legislators and the support that she's been able to provide through that encouragement of all of us. And we'll talk a little bit at the end of the conversation. I'll make sure to include some resources for everyone about how to become a community distributor through DAODIS, if that's something you're interested in, but also other ways to connect with local organizations where you can access naloxone to distribute on your campus, and that overdose education as well. So I know some of you are on this call because of that letter, and I appreciate the time you're taking to learn about what we're doing across the state and as well as in Louisiana. And if you have specific questions about that, I'd be happy to answer them if you want to throw them in the Q&A or in the chat. If we don't get to everything today, we can make sure to send some information out by email tomorrow. Hey, there she is.
My apologies. My internet decided to go down at my University of South Carolina, my USC basketball. We're gonna blame it on that.
Sure. I just made you the co-host again, Allison. So I've been, improving it up a little bit, trying to spend some time.
Yes.
But we are excited to hear from you.
I will get to sharing and jump right in.
Great. Thank you.
Luckily, I don't have any sound, right? So I don't have to contend with that. So that's always a plus.
Thank you so much for your patience, everybody.
Thank you. I really appreciate it. When I was trying to get my stuff together to drop, I wanted to see who all was here. And I can grab a chat transcript from Amy, but thank you all for having me. Very excited to share with you all today. Get the timer. All right, so one, I want to talk to you about not reinventing the wheel, being able to capitalize on some of the work that you're already doing and some of the work that the people around you are doing, because nobody likes starting from scratch. All right, so I'll tell you a little bit about me. I'm a native of Baton Rouge, Louisiana. I'm the youngest of 7 kids. I could live off a diet of hot wings and crawfish if I wouldn't have high blood pressure or it would kill me. I went to Southern University in 2009. I graduated with my bachelor's in psychology, graduated with my master's in public administration from LSU in 2011. I got my PhD in 2016 in higher education administration. That is the other language that I'm fluent in, English and administrator. Those are the 2 things I speak. And then there's a couple things I'm still upset by. I really like this show, Our Kind of People on Fox. It got canceled after 1 season. I was 2 seasons. I was very disappointed. As well as I just found out American Auto got canceled. It's not coming back. It's a really funny show. If you like The Office, you will love it. But to be balanced, I'll tell you 2 things I do love. That the writer's strike is over and that Abbott Elementary will soon be returning to my TV screen. And I am obsessed with the food that built America and also the toys that built America on the History Channel. So those are 2 amazing shows you can check out in your spare time. So a little bit about today. I promise not to make this all data heavy, kind of talking through a lot, but a little bit more practical in application, how we kind of got some of the things done here in Louisiana that we were able to get through. So don't be dismayed by all the very academic looking things that you see on your screen at the moment. So some background is that our office started originally at LSU, Louisiana State University, right here in the capital city of Baton Rouge, where I'm located. And you all also have a Baton Rouge in South Carolina, but with the capital city here, we started in 1998 after the 1997 binge drinking and hazing related death of Benjamin Wynn. That was at a time when there were a rash of high-risk drinking incidents across the nation, and LSU was selected to be part of the Robert Wood Johnson Foundation's A Matter of Degree program. And with that program, it gave funding to 10 institutions to employ environmental strategies to reduce high-risk binge drinking. And so that is where we saw the things of creation at LSU, such as LSU Late Night. Because typically what would happen on the college campus, that a lot of the alcohol and drug programming would happen like in front of the student union on like Tuesday or Wednesday or Thursday, maybe, when all the students were coming in and out the union. That's great to catch students, but that's not great at really deterring them from high risk drinking times, because that's not really when they're engaging in those types of activities. So that is where we saw LSU Late Night, which was revolutionary at the time for them, was to be able to come in and provide late night programming on like on Thursday and Friday nights in the student union from like 11 to 2, offering alcohol-free, substance-free programming on campus that students could use their ID cards to have something other to do than just participate in high-risk drinking. We were funded for 2 iterations of that funding, and when the funding ran out, our Office of Behavioral Health, our Louisiana Department of Health, along with the Louisiana Highway Safety Commission at the time, picked up the funding tab because the second iteration of our funding from Robert Wood Johnson called for us to start a statewide coalition. And I'll talk a little bit about that in a few minutes. But one, because the funding was ending for Robert Wood Johnson Foundation, our state didn't want us to stop the great work we had started to do with our statewide coalition, so they decided to fund it. That goes on for a few years, from 2006 until 2014. In 2014, we ceased funding with the Louisiana Highway Safety Commission, and we're completely funded by our Louisiana Department of Health. And eerily enough, 2017, fall of 2017, I think higher ed, the substance use prevention space kind of found itself in the same space, LSU not being immune to that. Made national headlines, almost a very similar death of Maxwell Groover that happened on LSU's campus, hazing related binge drinking. And with that, there were several deaths, high profile deaths, hazing deaths after that, like Timothy Piazza in Pennsylvania, several other students who lost their lives. And with that, our governor at the time asked every institution, what are they doing on alcohol and drug use? What kind of programming are they doing, kind of on hazing, on substance use? And what happened was, and I'm gonna put a plug in for Amy here. Some of our schools turned in their biennial review. Ding, ding, ding. And what happened was a lot of our state's administration, they didn't know what a biennial review was. They were like, if several people have something that's called the same thing, it must be a thing. And so they asked the school who had their biennial review, like, what is this? Where does this come from? Why do you have this particular document? Because the schools that had theirs prepared, they were literally able just to turn theirs in. But that some of our other institutions scrambling that weekend trying to figure out and clamor and pull all these pieces together. And so they were like, oh, we work with LAHEC, the Louisiana Higher Education Coalition. They help us. They do free biennial review training. They brought in Eric Davidson. They brought in Beth Rico. They gave us all these templates and they helped us get this done. Or they came to our campus and helped us walk through a half day of getting it done with us. I was like, oh, what's that? And so I like to say this, we got rediscovered that weekend. Some of you in your offices, you probably get rediscovered by new people all the time. And so that weekend, that was the busiest weekend of my life, probably in my at the time in my current role. And so with that, the decision was made one day we realized that our state, at the board that governs higher education, that coordinates higher education, there was nothing focusing on substance use prevention. And so we were voluntold that we would be leaving LSU's campus and moving to the Board of Regents. And that is where our office has been since July 1, 2018. Even though we were voluntold, it's like, yeah, what do you think about moving to the Board of Regents? And I was like, what's the Board of Regents? And they were like, yeah, and this was March 13th. And they were like, yeah, we're looking at March 30th. I'm like, absolutely not. Because one, like, we have a whole 7 more trainings I have scheduled. We have a whole conference, unless everybody wants to redo all of my contracts by the end of the fiscal year, we can just move on July 1. And so that is what we did. Because when you speak administrator, you realize they hate certain language. And I was like, we could redo all of these contracts, and understanding the language that they speak goes a long way for the audience that you're speaking to get some of your initiatives accomplished. And so with our move, a lot of people asked initially, well, what changed about your office? What changed? Essentially nothing. One, none of the initiatives that we were doing, none of the work we were doing was taken away. It just got expanded. We got access, and I'm very honest about this. We got access to a whole lot of power real fast. That is because now we have entered the policy realm, which is something we never entered before. And so when we were at LSU, it was a little bit easier for me to make noise on our other campuses because, I was like, I kind of like, hey, you all should do this. We're funded by the state. We're going to give you some resources. You should do these things. But it was very difficult to kind of do that at my institution, being at LSU, trying to be able to get some of that same buy-in. And so with that, we have a statewide focus. So please, let me give my disclaimer. Do not try to remember all these names. And one, yes, I am eventually going to get them to get rid of the name LaCassu. It's a long story. But it stands for the Louisiana Center Addressing Substance Use in Collegiate Communities. That's what happens when you're funded by 2 statewide agencies at the time that will not let the other person take over. And so with that, that is typically our statewide focus. And that is where our office sits on 3 policy boards out of our governor's office. For the Office of Drug Policy, we sit on the State Epidemiology Work Group, the Prevention Systems Committee, and the Heroin and Opioid Prevention Education, or the HOPE Council. And that allows us to bring a perspective in where we're able to provide additional research, recommendations, stats, all of these things from a college population, because we also serve that function for service that function for the Department of Health. We collect the only statewide data source on college student substance use. And that is like our linchpin of our funding. And I'll talk about how do you use those linchpins in a little bit. And the next piece is our campus focus. And so with that, we have our statewide coalition. So similar to like your Carolina coalition, community coalition, ours is Louisiana Higher Education Coalition. And so like a lot of the work that Amy does, I do, and I did that from LSU's campus. Now I do that at the Board of Regents. There are about 30 statewide coalitions, substance use prevention coalitions across the state, across the nation. But I'm the only one that's headquartered, like hosted at a Board of Regents or a governing board or some type of governing authority, which definitely influences the way that I'm able to maneuver, for better or worse sometimes, lots of times better, and I don't mind saying that. And so through that, we do our research and evaluation. Our big key piece of our funding hinges upon our alcohol and drug survey that we provide free of charge to all of our institutions. We coordinate all public higher education in the state of Louisiana. That's 33 institutions. And then we also we work very well with our private association, our Louisiana Association of Independent Colleges and University, which are typically religiously affiliated, and there's 10 of those who we work with as well. So when we came to the Board of Regents, our coalition has always served all 43 campuses. We came to the Board of Regents, we have coordinated authority over the public. So the publics typically they're required to do anything we pass through policy. The privates they're strongly encouraged, but we can't make them. But lots of them participate with us as if they were public because they understand that we're typically bringing up best and emerging practices for substance use prevention on their campuses. We do technical assistance. We do free trainings. Every year we host a statewide summit that is free, that we pay for their travel to attend. They get continuing education credit through there. It's typically somewhere between 6 to 9 hours they get. We pay for the hotel stays. We feed you really good. You can ask Amy about that. We have really good food at our summit. We're in Louisiana. We have really good food. And then we bring really high quality speakers because one of the things here, something interesting about our statewide budget, the two areas that are not constitutionally protected are education and healthcare. So those are typically the places that get cut first here in our state budget. Thankfully, we've been on an upward trend in our higher education funding, but that allows us to bring our campuses professional development that they're not always able to access from their campus budget. So I've always been very adamant about that it is free for them to attend, that we pay for travel, cover food, and they get reimbursed for mileage for all of our institutional liaisons and with our community partners. We have 10 regions, Louisiana Health Regions, and each one has a behavioral health office called a LGE, a local governing entity. And we have a liaison at each one of those as well, because that's great when I come around and go to the different areas of the state, but I don't live there. So that you need to have a contact that you're able to go to when you need naloxone, or when you need naloxone training on your campuses, or you need someone to do a health fair, things like that, and reinforcing that campus community partnership between those local agencies and the universities in their area. Right, so a couple learning objectives will just be 3 key things I kind of want you all to remember today. Understanding the importance of campus community coalitions and mutual support. Learn how critical overdose education and on-campus naloxone availability can be, especially with the increase of fake pills. And we'll talk about that later, that I believe strongly that the fake pill epidemic is a lot more alarming for the higher education community as opposed to traditional opioids, because lots of research tells us that college students just don't use opioids at the rate at the general population. And then learning how to utilize existing policies to support the expansion and other wins that you've already had. All right, so I'm going to quickly skate over everyone's favorite. I'm not going to spend a ton of time on here, but in the few minutes that we have. But one of the things a lot of us have heard of Bronfenbrenner's social ecological model. One, the interconnected systems, how the different layers of ourselves and our environment influence one another, that their interaction can nurture or stifle optimal development, and the programs and policies play a major role in shaping these systems. And if we change those, we can use those to drive public behavior. I like this approach a lot, because one of the things is that it's very easy to try to convince a person one-on-one to change their behavior or change. Actually, it's not. It's extremely hard, because you probably have a song that you like, or a weird food combination that you love, that you spend all day trying to convince people to try, or that it's really, really good. It happens. Because if I told you that if you ever ate a chicken nugget from McDonald's with a slice of pickle on top, that it's really, really good, I promise you, I know it sounds weird, but it's actually really, really good. But I could try to individually convince all of you of that. I worked at McDonald's. That was my first job, so that's why I know that. Or I can make a policy that says on Thursdays between 2 and 3, everybody must eat 1 chicken nugget with a pickle slice on it. I can make you do it without having to convince you at that point, because policy can shape your behavior a lot faster than me trying to convince you individually. All right. And when this came out, the social ecological model in 79, this was revolutionary at the time, that no one before Rothenberger had realized that you can change behavior a lot faster looking at the broader environmental context as opposed to just going one off. Because again, another example that people share often is seatbelts. people didn't just start wearing seatbelts. States didn't just start enforcing that. They only started to enforce it when the Federal Transportation Agency decided that they would withhold federal transportation dollars if they did not change their law or policy. That is how we're able to get people to move on their behavior. And then also, because at the time, I just want to understand, it was in the College of Home Economics. It wasn't even this really big field that now has evolved into the broader field of human ecology, that understanding how the ecosystem of a person's sphere of influence, their life works. And so there are several like pretty beautiful, cute implement examples of what this looks like. We've all seen a ton of these, just depends on which one you Google. But one I tend to like to focus here. That's 10 where we see like a lot of on campus, a lot of our student affairs, the interpersonal ones will focus here when they're trying to reach students one-on-one, trying to get them to change some of their behaviors. But these are the two areas where I like to focus. That I feel like this is where, and once you get to the policy sphere, the big behavior shifts, that is where you get the most done, the fastest, with the least amount of effort. And I know you all have time to burn, but I'm gonna help you save a little bit. All right, and so another version of the social ecological model was developed by the CDC, which I like a lot because one, it enables community engaged partnerships to identify a comprehensive list of factors that contribute to poor health and develop a broad approach to health problems that involves actions at many levels to produce and reinforce change. And one of the things that was really cool, the first level about the model is the extreme right, the societal piece includes individual biology and other personal characteristics, individual personal characteristics such as age, education, home, and income and health history. The second level refers to a person's closest social circle, those people closest to your friends, partners, family members, all of whom influence behavior and contribute to your experiences. With the third level being community, which explores the settings in which people have social relationships, such as schools, workplaces, and neighborhoods, and seeks to identify the characteristics of these settings that affect health. And finally, the fourth level looks at broad societal factors that favor or impair health. Examples include cultural and social norms and the health, economic, educational, and social policies that help to create, maintain, or lessen socioeconomic inequalities between groups. And this is what I was describing. Sorry, I was ahead of slide. So the individual, relationship, community, and societal, this is the CDC's condensed way of looking at that. And so when I talk about the things that are more interpersonal, that would be those two, the relationship and the individual, and the broader scale, looking in the social, the societal, and the community, being able to look at the broader picture and not necessarily spending all your time on a very small population. And so when you look at that society, looking at those kind of community pieces, what things do you have in your hand? Part of that is understanding what do you have at your hand and what can you do with what you have? So one, like clearly one, you all have the University of South Carolina, you have Amy. So that is already a wealth of knowledge and resource at your hands that you one can utilize and leverage. Amy really is a national leading voice on this particular topic. So one, being able to use what you have just locally, partnering with other colleges or other organizations. And then also if she's not close to you, things like that, I'm sure there's someone else in the state of South Carolina that's doing some of these things, some especially like some of the recovery, the RCOs or different, your state Department of Health, other organizations or agencies that share the same mission with you. And then also if you just can't find anybody in South Carolina, which I doubt, but there are more people across the nation that are willing to help you as well. And I know for sure there's a person here in Louisiana that's willing to help you. I'm willing to do whatever I can to help assist you all in making naloxone available to all of your students. And I'm a big fan of free. I don't like for students or campus to pay for anything because I feel like there's enough money everywhere to pay for all this stuff. So one, just remembering that we're all in this together, that you're not alone trying to do this, that there are people who have come before you, who have done this, who have blueprints, who don't mind sharing templates, model policies, or any of these things with you. Right. And so one, understanding how public policy can shape societal realms, I think will be key. And I think, and so let me give my disclaimer, give my political disclaimer. By me saying I speak administrator, part of that means is that understanding the realities in which you live does not mean that you pretend that they don't exist. It means you find a way to speak to what you need in the climate in which you live. So every day that means getting up to do the best you can and going to bed at night, sleeping well, knowing you did the best you can without compromising yourself. And so for me, what that means is talking to everybody. And one of the things I found is that opioids has been one of the issues that has been completely neutral on everybody's side. That has been something that everybody's been looking to do something on. That I know some issues are controversial currently, but this has not seemed to be one of those issues. So I think it's an area that you don't need to have any fear about stepping into. One about because sometimes now that's not saying you won't need to do any education on what this policy is or what this practice would do or what naloxone is. You may just need to, one, be sure that you're tailoring your message to the audience you're speaking to at the time. So this was me back in 2019 at the Office of National Drug Control Policy at a session they hosted on expanding campus naloxone availability. We were, at that time, we were actively looking to expand. We were getting ready to launch our policy that summer, the next summer coming up. And I just want to, I want to show you this, but I want to point to this guy. This is one of my like guardian, like fairy godfather, I will call him. He has been an amazing help, and I'll share a little bit more about him in a little bit. But one, this is us having that conversation on a national stage. And so part of about speaking administrator is being able to lean on the words that have already been spoken to get what you want done, already done. So leaning on the words of the federal government, this is their policy. This is the best practice. These are that. So when you can pull a federal policy, you can pull a state policy or a stated goal, and you can pull an institution or organizational stated missions, values, and goals and tie them to the action you're doing. That creates the path of least resistance for you. And so for us, that looked like our goal here in Louisiana is to graduate 60% of all working age adults, 25 to 34, have them have a high value credential by 2030. One, naloxone, we want to talk about substance use prevention, harm reduction, all of those things. That helps us push people towards graduation if they're able to stay in school and stay well. That is also the goal of the Louisiana Department of Health, is to get naloxone everywhere they possibly can. So finding your way into other people's missions and goals goes a long way in getting support on your team. So that's where we started to see some of the peak interest. So after 2019, we had that meeting at the White House. We started to see some interest. Our agency was backing us and the Department of Health was backing us. But what was interesting is that we started to see some interest from some of our legislators. So here on our screen, you see 4 of our legislators. We have a state representative who is a Democrat, a state representative that's a Republican, a state senator that's a Democrat, a state senator that's a Republican. And what we found was that all of them wanted to do something on opioids. And again, it was not a hot button issue because they were all concerned about saving lives, because opioid overdoses don't discriminate. They don't play culture wars. And so one, being sure that they can keep the most amount of people in Louisiana safe in every community that they could possibly get naloxone to. And so one, and I will say this, I love our legislators, but sometimes as a person who's spent 8 years working on a college campus, and I will probably share the sentiment of many of you, I hate an unfunded mandate. Absolutely hate it. And so one of the things we decided to do, we met with some of their staff, we met with some of our legislators, like, hey, we know you're interested in doing something on naloxone, but we actually have this office here at the Board of Regents. We have a great relationship with Louisiana Department of Health. We work with all the regional health offices. We work with all the colleges. Allow us to craft a policy, one that will be more practical in implementation. We'll craft the policy, we'll create the training, we'll provide TA, and we'll get the campuses free naloxone. And they were like, "You gonna do all that? Sure, works for me." And so that's what we were able to do. And in crafting that policy, we decided to talking to all your stakeholders and using the messaging that you need to do. But then the next piece, we have 4 public higher education systems here, and then we also have our private association of higher education. So one, we have a technical, the first picture represents the president of our technical and community college system. The next one represents the then president of Louisiana State University system. The third one on the top represented the president of the Southern University system, which is the only HBCU system. And then on your bottom left represent what at the time he just that's got a new position. He was the president of our University of Louisiana system, which represents our regional institutions. And then we had former executive director for Louisiana Association of Independent Colleges and Universities. And with that, we got support from all the system presidents, and they all designated a staff member from their team to work with our office to craft the policy. It wasn't that it was just thrown together and we gave it to them and say, oh, how do you? No, I sent the draft policy out to every single institution and said, here's a week, take it, tear it apart, give me your feedback. What are your concerns? Once we got that, we sat down in a room, I cataloged all of the responses, what they did and did not like, and we went through line by line. This is what you don't like. This is how we can address it. You don't like this, but it has to stay. Some of those things, but one, creating buy-in in that process. And so when I mentioned about Lucas Hill, he is phenomenal. That was my phone a friend. So when we went to craft this policy, y'all, this was the first piece of policy I ever crafted. Because again, I told you, we just did programmatic work. We didn't do policy. And so Lucas, he worked with Operation Naloxone at UT Austin. They have a phenomenal program. And he sent me all of their documents. And he was like, this is what we did. This is what I wish we could have gotten done. We could have gotten added, all of those things. And theirs was funded by their Texas Targeted Opioid Response Fund. He's like, see if they have money there. And we did. Oh boy, did we. We had money from the state opioid response grants as well from Louisiana. And that is how we paid for all of our naloxone for our campuses so that it would be free to them. And then also, again, there are people all over the country who I reached out to. One, there are people who are out here who are willing to help you if you're unsure of where to start. And so I mentioned all of those things that we were doing, all of those meetings I had with our systems, all of that feedback, and it produced the policy that has three components. It teaches students the dangers of opioid use and how to spot an overdose, places free naloxone on each campus. It requires annual training, and that for certain groups, it requires that be placed in certain places. So it's placed in our residence halls, and our student health and wellness centers, athletic training facilities, our Greek houses, campus police, all campus PD carry it. And then if there's an overdose administration, there's a form they have to fill out within 72 hours. And then each quarter they certify whether or not they use any kits, and if they need any new kits, their kits are expired, we can order them more kits. All right. And so for our training, it's annual training. I'll kind of breeze through these. I kind of gave you a summary of that with the policy. It's annual training, and a lot of our campuses utilize Generation RX, which is training we initially started doing with them right before COVID shut us down. And it's easy, it's free, it's turnkey, it's easy to use, and it's segmented for different populations. We provide a training. We actually just released a new training module. We provide the training for them they can load it into their LMS, like a Moodle, a Blackboard, a Canvas, to assign it to people who need to take it. And then also they're able to reach out to their local governing entity to get free training, in-person training on their campus. So I'll back up one second. So this is one of the things that I learned. So when I talked about, we had it was not always a happy meeting when we were meeting with the systems to discuss the policy, because one of them two of the people were lawyers, and it was like, yeah, I hate to bring this up, but there's a liability concern. We're concerned about all that. But we talked about our state's Good Samaritan laws, things of that sort, because one of the things we talked about the policy is that, so it has to be that you can decline to administer. So they're like, what if we have a staff member or RA who does not want to administer naloxone? Like, we can't make them do it. And so our compromise was that they are not required to administer, but they are required to be trained. Your job can require any training once. So because what we don't want to happen is that a student or an employee gets into a situation, an emergency situation, and they say, the adrenaline starts rushing, and like, if I had known what to do, I would have done it. Either way it go, whether they administer naloxone or not, they still have to call emergency medical services. But we want everyone to be trained should they feel confident enough to use it in the moment. And so that was enough to satisfy the lawyers on our group. And this is about their reporting, and the forms are very short, very easy. And so typically I have a rule, because I speak administrator and I hate doing paperwork. Anything I have them submit to us is usually 1 page or less. It is a full page or less. I found a way to ask questions where I can get the information in the full page or less because I don't want it to become burdensome on the campus that we're trying to help. All right, so some of those community and organizational realms, this is building upon the things we didn't just start having naloxone on our campus with support of everybody. That's not how it started. Our office had been doing this work, community coalition building, for about 10 or so years before we started there. And this was back in 2019. With This is me partnering. I sponsored lunch and some training stuff early in the morning for our HBCU, Southern University here in Baton Rouge, where this is Capital Area Human Services, their local governing entity, doing training for the police department there, and we gave them all free naloxone there. And again, this is a year before the policy was even passed. One, because they were starting to see things that concerned them on their campus. So the next year with our regional training, this is me and Baton Rouge training all of our, and we invite, for each region, we invite all of the campuses, all the relevant campus staff, and then we partner with the LGE to find us a free space to host, and they invite the community provider side. So that was us in Baton Rouge. This was us in Lake Charles. This was us in Shreveport. This was us in Monroe. And this was us in Lafayette. And then COVID happened. And then we stopped there for a moment, pause, and we're going to resume our regional trainings back on February of next year. But this is kind of how our regions are broke up. And so being able to go throughout our state and we reinforce it with those health offices. Yes, we come in through training. We make sure that all of our campus people know the people at their local health office, and that all of the people at the health office know the right people on the campus. Because that was something that we had to do a little bit of education on, because it's not, no, you don't need, I sent an email and the president didn't email me back. Well, the president's actually not who you need. You actually need to talk to the director of the Student Health Center. So sometimes being able to connect them to the right people, because the president's not coming to your community health fair on the Thursday night. That's not who you need. You need to talk to them. Maybe they can send some of their peer educators, but getting them connected to the right people. And some of the other programming initiatives, because one, understanding this, the administrator speak, we understanding that there's a ton of money in opioids. That is where a lot of money is. But look at what the research says. This is what college students tend to use: stimulants more than opioids. And so one, I told our Department of Health, I'm like, I can talk about opioids because none of our, we don't really have extreme, high numbers of opioid data use among any of our colleges, regions, or our state. I said, but you have to also allow me to talk about stimulants, because that is where we're seeing the issue more so. And that concerns me when we talk about fake pills. We talk about fake Adderall or Vyvanse or even cocaine that's been laced with fentanyl. That is more concerning to me, seeing what happens across college landscapes. They're like, okay, as long as you talk about both, that is fine, which is why we really lean towards Generation RX, because it addresses both of them. It's already built in and it's established to address both of those things. And so it reinforces those 4 key messages, especially when we talk about things like one pill can kill, from the DEA and their website, that it doesn't take much fentanyl to kill someone. And it really hit home for some of our campuses, because we had a student that passed from one of our local institutions where she took what she thought was Xanax, and she languished in a coma for a week before she passed. She was not intending to take fentanyl, thought she was taking a Xanax, and her and her friends were just hanging out. But that campus had moved to very well. Now that campus is acknowledging International Overdose Awareness Day. They've done things, planting flags for people they've lost in their community. And then also we have another class and another campus in that particular system that was the home to our first collegiate recovery community here in Louisiana. They've heavily been pushing Narcan education to their campus to tell them you can stop buying it, how to overdose, making it very accessible to those campus communities. And then as I wrap up and give it back over to Amy, I want to remind you of 3 quick things. Research, find out what's being done out here. Find out whatever policy, if there's a state that your state tends to mimic anyway, sometimes. If you're in the SEC, look at other SEC schools. If your state has other, when it comes to health research, that they partner with institutions or things of that sort out of state, looking at what are they doing on this particular topic. Collaborate with others, with other agencies. Don't discount the work that other people are doing, and one, make it easier on yourself. Sometimes it's not, you don't have to reinvent the wheel. Reach out to people, and then once you get the hang of it, be sure to share that with other people. We can all use a little bit of ease. And with that, I will turn it back over to Amy for any questions.
Thank you so much, Allison. I appreciate all the information that you shared. Allison always does a great job of piling in some extra things that are helpful for us, like theory, that are good reminders. So I love to geek out about that stuff. So thank you for that. Also, I do have to say that if you want a conference with good food, the best place to go is what Allison does in Louisiana, because it is great conference, great presenters, and an excellent menu. So, yes.
I try.
I thought we were going to have Linda Brown from DEODIS, which is our alcohol and drug state agency. She is not able to join us today, but we will do our best to fill in some of that information, and I'll provide some resources for you in the chat as we have conversation. If you have questions for our presenter or our panel, feel free to throw them in the Q&A or in the chat, and we'll do our best to kind of capture all of it. I wanted us to take a few minutes and have Rachel and I share a little bit about what naloxone distribution looks like on our two campuses, so that we can give you kind of a sense of what else is going on in the state, and then we'll have some conversation with Allison or with Dr. Smith as well. So here at USC, we became a community distributor of naloxone through DEODIS last fall, so August of 22. And in the last year and a little bit, we've given away an average of about 100 boxes of Narcan every month. DEODIS funds the Narcan. So we are getting, that's not at a cost to us. We order it. It is delivered to our student pharmacy and has a standing order provided by a campus physician. So there's a lot of different ways that organizations access that process as a community distributor. That's what we've done on our campus, because we have the benefit of an on-campus pharmacy and medical providers that are able to provide that documentation and that shipment, receiving, whatever. And we distribute primarily through our office on campus, as well as distribution events, typically in some of our high traffic locations and prior to high risk times, for example, Halloween, and other times, spring break, other places, times when we know that there may be a higher than normal amount of substance use happening. The primary conversation that we are having with students around naloxone and the risk of overdose is related to cocaine and fake pills, like Dr. Smith mentioned. So those are the conversations that we're having mostly, but cocaine is the thing that I think when you say there's a possibility that fentanyl is in the cocaine that your friends are using, it gets some folks' attention, because that, I think, is a while it's not prevalent, it is a more common thing. We've also tried to target some of our high-risk populations. So we work closely with our fraternity and sorority life staff and have recruited student peer educators from those populations, so that our high-risk students are talking to other high-risk students about Narcan and overdose, and making sure that they're getting the resources where they need it. So that is kind of what it has looked like here at USC. I will turn it over to Rachel. If you could just tell us a little bit about what naloxone distribution looks like at College of Charleston.
Thank you, Amy and Allison. That was great. So at College of Charleston, we are not a distributor, as Amy's group is. So what we have done is we partnered with a local agency that can distribute Narcan, and we host through the Office of Student Wellness and Wellbeing twice a month trainings where students can attend and receive Narcan kits. In that training, we go over very similar things that Amy goes over as well, including some state statistics around opioid use and relative lethalities around that. Yeah.
Great, thank you. And Rachel and I had a conversation earlier about just all the different ways that there are to train folks, right? So you can do that as a lengthier conversation where you're having a more discussion about the risks or about substance use on your campus. You can also do it. The state law requires us to educate folks about the signs of overdose and how to respond and how to use Narcan or naloxone. And so that piece of it can take less time. We have used Narcan as our sexy foot in the door for some organizations that maybe wouldn't have called us to do a presentation for them about drug use, but because they want Narcan, when they call and say, hey, can you come give Narcan to our group? We say, well, sure. Can you give us about 30 minutes to have to do some education for you? And so we've been able to connect with some groups that way. So feel free to throw some questions in the chat or in the Q&A if you have it. Allison, I'm wondering what your experience has been with one boxes, overdose kits that are mounted on walls, those kinds of products. What has that looked like in Louisiana?
So we were actually in the process. So here's my administrator speak. We were in the process of looking to purchase on one boxes, and then administrative paperwork got in the way. And so we will be looking to circle back to that in fiscal year 25. And it literally was against the clock thing for as our fiscal year 23 closed out. And so looking at some additional funding we have coming in fiscal year 25, that was one of the things that our campuses, we actually did a webinar with Susie Mullins and Dr. Susan Bissett with the West Virginia folks. And our I fell in love with it when I saw it in person. And so one of the things I am, even as much as I liked it, I still brought it to our coalition to see if they liked it. Because it's not about what I just personally like. And they were like, that would be great. And then I'm like, yeah, you can order one or two, but you can hold on and you can let me find a way to pay for it. And so when we're finding a way to pay for it, being able to get that to them. And one of the things that our campuses really like is that it has the dual language in Spanish. That was the thing that several of our institutions have seen their highest enrollments of Spanish speaking students. And so for them, it's important for them to have that. And so that's why we're definitely leaning towards that. But currently, and this was another thing I learned in the process, that a lot of our residence halls do not have first aid kits on the wall because it's a liability issue. And I was like, never knew that was a thing. But so that's kind of how I was like, initially we were having the conversation, like, well, you can just put them like where your first aid kits and like fire extinguishers are. And it's like, well, technically we don't have those because, so that was our compromise where you have to be trained. You don't have to, you can decline and administer, but you have to be trained. But because there are not a ton of temperature restrictions on it, when part of our policy, because that was one of the questions, where does it have to be kept? We decided upon, and I told them that we would give them some autonomy in that a reasonably accessible location. So if it's required to be in a residence hall, I'm like, I don't care if you put it at the RA station and it's in the second drawer on the right. Everybody needs to know that it's the second drawer on the right. So you all can set your own internal policy. We'll give you guidelines, but you have to stay within that framework that it has to be reasonably accessible. If there's a overdose on the third floor, there needs to be Narcan accessible on the third floor. And so if you all want to put it in a bright pink pouch tacked on the wall, everybody needs to know it is in a bright pink patch tacked on the wall. Just being sure that you communicate where the availability of it is for your campus.
One of the things we have done with some of the support from DAODAS is magnets. Magnets are super cheap for folks who are looking for a distribution item. But what we created a magnet that says we have Narcan, has a QR code that takes you to a video that tells you how to do it, has the no call stay spray amnesty, kind of our Good Samaritan marketing piece. And then it has a line for the students to write in where your Narcan is kept. Because some of the conversations that we had with the students is you can't give Narcan to yourself. And so if you have this, other people need to know this so that you can share it. So if you've got the party house, folks need to know that the Narcan is on the refrigerator on top next to the Cheerios or in the bathroom medicine cabinet. And so the magnets they're able to put that in a place where anybody who's hanging out at their house knows where to find the Narcan when they need it. So that has been one of the things that came from our students, right? Because they're the ones who have the best videos.
So one of the things that was interesting for us, because I asked the question, I was like, I know that some of our campuses have their Greek for housing. It's private. I was like, can we regulate that they put it there? I know it's private housing. They were like, and this is where the lawyers became my friend. It's like, yeah, they have a contract with us. We can require whatever we want. They have to be required to have like certain safety things in the house. And so everyone who lives in those houses has to be trained, and there has to be Narcan in the house. And so one, providing training to them, making sure, like I said, I think that's key, communicating, making sure everyone knows where it is. Because again, you can't give it to yourself.
Right. I will say, and Rachel, I don't know what your experience has been at College of Charleston. For us, it's been a nice addition to the bystander intervention conversation, right? So because you are picking this up because you are concerned about your friend's use, right? You maybe it's because of your own use, but chances are you're the folks who are getting Narcan from us often are the ones who say, I'm worried about my roommate, my fraternity brother, my friend who is into the partying a little too much. And so it's been a great way to have a conversation about what do you say to your friend you're worried about, but also just what's your responsibility as a good bystander. And so we appreciate kind of those conversations that we've been able to have with students.
Yes. Almost everyone who attends tells us that they are getting it for fun. But I feel like that could be a joke. And honestly, we definitely know some of them are truly worried about their friend, or as you're saying, I mean, that parties happen where they are, or they have a suite mate that they're not sure if they're using, but their behavior is high risk and they want to make sure that they're prepared. And I think that does give an avenue of kind of supporting people, advocating and kind of intervening in the spaces where the behavior is.
Yeah, that, and I think so. Like, I have a niece who is 19. She is a sophomore, well, technically a junior. She got some dual enrollment credits. And one of the things I explained to her, because I have this conversation, I give her the auntie talk. I'm like, don't try to explain to me. Like, I'm not your parents. I don't want to know. Like, I don't. Like, so just listen to me. I'm like, I give her to just listen. So she left like, listen. And we talked about Narcan. So I've given her Narcan things like she's like, oh, so it's like a designated driver thing. And I was like, yes. And I was like, great that you made that connection. She's like, yeah. She's like, so if someone else is around, she's like, and I can just give it to him. I was like, yes. So she understands. She's like, and it was just her making the connection because she understood it when it came to alcohol, about being the designated driver, being the person who's sober, the person who can help someone else. She understood it about that. So I think, like Amy said, tying it back to the broader conversation, like this is the work we've been doing for years with alcohol. It's literally switching out the substance and the intervention.
Definitely. I am putting one more resource in the chat, which is the site for all of the community distributors in the state, because I do think that there's an opportunity to partner initially with your local organization. So whether that's your local treatment agency, recovery community organization, Department of Mental Health, there are lots of folks in your community who are want to do some distribution events with you. And that is one of the ways that we identified the need early on, was because we did some partnership events where we brought an RCO onto campus to distribute prior to spring break. And holy cow, were we surprised by all of the students who said, I'm going to a festival, I'm going to a concert, I'm going on a trip with some people who are going all out for spring break, and they wanted to be prepared. And so those initial early events were kind of one of the ways we pilot tested, is this a thing that we need to do on our campus? And I think Rachel's having a similar experience with, like, we're doing these two times a month and being able to track, like, there's an interest, there's people who want this.
Yeah, the pre-Halloween one was definitely, one of those times.
Yeah.
And then also spring break last semester too. Yes. I think we had a very high number right before spring break.
Yeah. we gave away 140 boxes in like 3 days in the spring of 22. We're like, oh, okay, we do need to figure out how to do this and not overwhelm our RCO. So we are out of time. I want to say thank you again to Dr. Smith for joining us and for sharing all of your wealth of knowledge and experience and giving us a good reminder of all the different ways that we can influence student behavior at all the different levels, including through policy and community work. I've put a ton of resources in the chat, and I will include some in an email that will go out tomorrow, and happy to be a resource for any campuses in the state that are trying to figure out what you might want to do from here. So thank you. Please join us in December. Jody Mans from the new South Carolina Center for Excellence in Addiction is going to be joining us to talk about all the things that they're doing and some of the new statewide work there. So thank you all. Thanks for
Thank
being
you all for having me. Have a great day.
Thanks, everyone.